Hello, everyone. Welcome to the Pathways to Family Wellness podcast. My name is Dr. Brendan Reardon, pediatric and family chiropractor. And joining me today for the second time is Dr. Andrew Dorough. Dr. Andrew, thanks so much for joining us.
Thanks for having me.
Yeah, I really appreciate this. I think other than Peter Gray, you may be the only guest who's been on twice on this podcast. I apologize if I'm forgetting someone, but here's our second recording. So this is going to be great. We're going to be speaking on a topic that I know is near and dear to your heart, which is birth trauma. So I'm definitely looking forward to unpacking this a bit with you. Let me go ahead and read your bio and then we'll jump into it. So Dr. Dorough is trained in serving families, pregnant women, and children. Over the past decade of being in practice, his special interest lies in caring for infants who have birth stress, strain, and trauma. He's had the pleasure of caring for these little blessings while working at a family medicine clinic from 2016 to 2023, and now owns and operates his own clinic to carry out this mission. Dr. Dorough also enjoys sharing his experience through instructing with several organizations on a local, regional, and national level, including Gold Learning and the ICPA. He enjoys collaborating with other healthcare providers about infant well-being and how to best serve family in our country. He currently owns and operates his own clinic and consults other chiropractic clinics around the country with the goal of training and implementing care strategies for infants who are in need. Dr. Dorough, thanks very much for joining us.
Thank you for having me.
Awesome. So we did a podcast about a year and a half ago or so, where we talked about a really neat paper that you had published talking about birth trauma specifically, and it had an emphasis on tongue and lip ties, tethered oral tissue, chiropractic care. It was covered a lot of different topics, and it was an amazing paper, still is. But I'm curious, we can talk about this a second time. What is it that got you so passionate about this, or how did you find yourself working with birth trauma and becoming interested in this topic?
Yeah, my first introduction was through the ICPA from Genome. When we got Webster certified, she had a section, a preliminary section in there covering why Webster technique is so important. And that's when I learned about this concept of birth trauma. And when I first saw I guess you would call it a traumatic labor and delivery, I was in a way awestruck. I couldn't quite believe that in some instances, infants could sustain these kinds of head and neck injuries. And furthermore, I was surprised to see that there was a chiropractic solution to help potentially try to avoid it. So that was like my first introduction, if you will. And then fast forward over the years, I just felt that I could spend a lot of my career potentially just caring for infants who came from a labor delivery who didn't get that kind of care, chiropractic care. And eventually, I found myself working in a medical clinic, of course, caring for infants who had feeding dysfunction, and accidentally uncovered this incidence and prevalence of this spectrum of birth stress, strain, and trauma on an infant that could potentially exacerbate a feeding difficulty, cause it, or contribute to it. And that's kind of where I started to unravel and discover this huge gap in care for neonatal well-being.
Yeah, absolutely. Now, what was it that you observed specifically? I'm curious what you said you observed a traumatic birth.
Yeah, I think Dr. Ohm had showed a few videos that were, I'm sure you've seen these if you're Webster certified. Obviously you are. And when I saw the infant, for example, being pulled through the birth canal with hands, and when I say this, I don't mean to be disrespectful to the obstetricians. They have a very important job in many cases to help get this infant to the extrauterine world in a safe way. And sometimes, no matter what you do, it's troubling to get these little blessings out. And they have to do everything they can to get them out to save their life. But with that comes consequences. And I think that we should recognize it and respect it in both ways. Respect that the OB has a job to get done, and respect that the infant, and recognize the infant might have sustained some sort of injury from being tugged, pulled, or forcefully removed from the mother. And when I saw that, I was like, well, geez, if I did that to an infant's neck in my office, I would have some serious issues. I would probably be reported to the board. Infants can only stand so much pulling force. And when I compared that force to what a chiropractic adjustment would do, it just made sense. That's the why. It showed me the why on spinal injury and why an infant would need care. Because if you think about the history of chiropractic, it was kind of labeled as a neck treatment, a neck pain treatment. And that's not really what this is about. But if you look at this from an injury perspective, and the neonate has a spine cervical strain sprain injury, it has been proven in the literature that chiropractic care is one of the gold standards of caring for an injured spine. And if you look at this mechanism of injury in the birth process, it makes beautiful sense why an infant, or every infant, should at least be screened for these kinds of subtle or obvious spinal
Yeah.
injuries.
Beautiful. And you said subtle or obvious. So I think sometimes when we think of birth trauma, we might think of these gross mechanical things that, everyone, when we're thinking of trauma, and I'm sure
Mhm.
that's a component of it, but you're talking about, and what we're talking about is more like micro traumas as well, or that might not be observed. So I'm wondering if you can differentiate the two, maybe some incidents between what may happen for macro versus micro trauma and things like that.
Brendan, I thought you'd never ask. I'm
Yeah,
happy you
right.
said this, because this is where I think people tend to just kind of gloss right over it. If when we think of gross trauma, big trauma, we think of fractured bone,
Yep.
severe hemorrhage, bruising, obvious things, injured nerve, like Erb's palsy or
Yep.
brachial plexus injury. The arm is floppy, it doesn't work. That's a severe. But you would agree that injuries occur in a spectrum. For example, tongue tie occurs on the spectrum. Physical issues don't just present in the severe form.
Yes.
So why would we stop that at an infant spinal injury?
Yep.
So my concern is these less than severe are much more common than the severe. For instance, in the current best research, severe trauma is 3% of 1,000 live births.
Okay.
That's still a large number,
So
but we can
30
all
out of 1,000. Is that what we're
30
talking?
of 1,000.
Yep.
And in St. Louis, in one hospital per year, we have 14,000 labor and deliveries. So 3% of 14,000 at one hospital. You
Yeah.
multiply that by hundreds of hospitals in the US, you have
Oh,
a
yeah.
large number.
Yep.
And that is my concern. That's the severe form.
Yep.
But what about the less severe? What about the 25-mile-an-hour car accident, not the 70-mile-an-hour car accident?
Yeah.
So looking at an infant for subtle or moderate strain sprain injuries, we can look at, first of all, there are indicators in labor delivery that might indicate that there's been additional forces applied to the spine. So, for example, how the child was delivered. If the child was delivered vaginally, was there a forceps involved? Was there a vacuum? Was there tugging and pulling? Was there a hand-assisted delivery? That can indicate a subtle strain sprain injury to the neck. Was it an emergency C-section? Was the mother's water broke for more than a couple hours, where that bag of waters was not cushioning the cranium to the pelvic floor, causing facial bruising, compression of the head and neck,
Mm-hmm.
spraining that joint in the neck, compressing nerves? Was there a stuck shoulder or
Mm-hmm.
shoulder dystocia? These are indicators. Then if you look at the baby, you can look at physical obvious signs, maybe obvious to a chiropractor, but not so obvious to a pediatrician or a caregiver.
Right.
So these subtle signs on an infant could be misaligned head on the neck, kind of a
Yep.
tilted or twisted neck. Could be a eye misalignment, ear misalignment, unlevel jaw, one high shoulder. The baby has a curved spine.
Mm-hmm.
Maybe there's facial or head bruising right after the delivery. These are called hematomas. There could be visually or the parent could report that the baby has colic-like symptoms, doesn't like being laid on their back, and maybe has feeding difficulties. These are signs or symptoms that are less than, I would say, dramatic, but
Yes.
still subtly obvious. And my concern is what's going on in that neurology deep inside.
Yep.
And that's where
Well, and
we're at right now.
that's a connecting link that I think is really important to make, is that mechanical stresses do affect the nervous system.
Mhm.
Can you speak on that or unpack that a little bit more and what that might look like? Because I think this is something that I know we have this conversation piece a lot in the office, and sometimes it's something that has difficulty landing, because I think there's a lot of people just aren't connecting the dots, and it's not their fault. It just, this isn't something that's been known, and so it hasn't been, these dots have not been connected for them.
Yeah, it's challenging to relate a mechanical force to a bodily injury and pain, because we all can agree that babies can't talk for themselves.
Yes.
And that's my concern. We have to be very diligent and astute in our assessment, because we're working with a population who's the most vulnerable in the world,
Yep.
the most delicate beings in the human species, and we should recognize and honor that. And just because they can't talk for themselves doesn't mean we shouldn't examine them for these things, especially if there's indicators that make perfect sense. So
Yes.
we can all agree that pulling on a baby's head and neck at 25 pounds of force to 30. I mean, even my 8-year-old says, well, that's not good, Daddy. I go, honey,
Yeah.
I agree. So
Yeah.
what do you think we should do about that? And she says, I don't know, just kind of love it gently and massage it. I go, right? So even an 8-year-old can understand why this should be looked into more deeply.
Yeah.
But what we look at, your question originally was, how can we relate mechanical forces to a baby having pain? And what does that pain cycle do to a
Or even like
child's
visceral dysfunction or
visual
neurologic
dysfunction?
dysfunction, anything like that, right?
Sure. Yeah. If let's, for example, say that the head and neck was compressed in labor and delivery, and the nerves that come from that neck go to the thyroid or the feeding tissue,
Yeah.
the tongue, the mouth, or it goes to the heart and the lungs. If we all know that compression on a nerve changes and alters the function of that nerve.
Yeah.
So if that nerve goes to any other organ, that will change the function of that organ. So we can relate the labor delivery signs, the physical signs in the baby, and tell the parent how that can affect the baby's function as a whole, not just how they feel.
And do you find that because you said the most vulnerable population, because infants, especially newborns, don't have a high level of spinal tone typically, there's not a lot to support. Usually spinal tone is one of the main things that helps to support the spinal canal and the IVF and all the different, from without getting into the weeds too much, but that's part and parcel to maintaining the integrity of the nervous system is good muscular spinal tone.
Yes.
So do you find that the injuries are greater simply because there's not the spinal tone to support that?
Correct. I'm so happy you said that. If you've
Yeah.
seen what I will call an aggressive labor delivery where they're tugging and pulling, you'll see that
Yeah.
the baby is not guarding and pulling against that person, that they are being stretched to their maximum.
Yeah.
I've
Okay.
seen necks on an infant appear to look to be 3 to 4 inches long
Oof.
while they're being pulled. And that to me is like, okay, they don't have the guarding reflex yet. They're
Yes.
immature and they can't protect themselves. So that is another reason that they're more vulnerable to these forces. They
Yeah.
cannot protect themselves.
Yeah. That makes a lot of sense. And now to back up, but also to unpack something else, have you noticed the different types of delivery may show up as different types of sprain strains? Like what
Mhm.
you may typically observe with a cesarean versus a forceps versus a vaginal. I know there's a huge variation among that. So like a forceps vaginal delivery versus an unassisted vaginal delivery versus vacuum and things of that nature.
That's a really good question. And I can actually kind of compartmentalize in two categories. In
Yeah.
the physical world, there are two types of pressure. There is positive pressure, which is like that compression vice-like
Yeah.
pressure. And then there's this negative pressure, which is
Yeah.
like that
Okay.
suction force. So if you put your finger in your mouth and you make that pop sound,
Yep.
that's a reversal, negative pressure. So with the labor delivery forces and mechanical pressures, there are different types of modalities in labor delivery that exert those types of pressures. So for example, if the mother is pushing for a couple hours, that's that positive compression, like that is compressing the spine downward. It's like taking a spring and just pinching it together. That's compression. And that can compress and strain the discs between the spinal bones and then
Yep.
compress the nerves.
Okay.
On the opposite spectrum, you have this pulling, which could be maybe the hand assisted delivery or the forceps or the vacuum that's
Yep.
creating a suction inside the canal, like a Chinese finger trap.
Okay.
And
Yep.
that can actually strain and sprain the ligaments around the spine that hold those bones together, cause swelling where the nerves are, and result in the same type of neurologic presentation, but could feel different to the baby.
Yeah.
So you can really unpack what kind of delivery created what kind of pressure and extrapolate that
Yeah.
on the baby's behalf.
And that's part of why taking that thorough history is so important. I'm sure in your clinic as well as in ours, you really want to find out the specifics of what happened. And it's in no way, usually there's can be some guilt that goes along with it. And there's like emotions can get pretty heavy around that. And I
Sure.
always try to communicate that's really not what we're talking about. It's not about putting guilt anywhere. We just want to understand what happened and to
Sure.
try to piece it together, like piecing the puzzle together. It's like, okay, can you see
Yeah.
how this one eye is squinted, one eye is quite a bit bigger, the jaw is tilted to one side.
Right.
Was little one tucked up against your hip? And mom will usually say, oh yeah, the whole pregnancy they were tucked up against the hip. and when I was pushing, I was feeling pain in this particular area. It didn't seem like the little one was engaging properly. And so it stands
Right.
to reason that sustained pressure, like what you were describing, would produce a
Mhm.
particular sprain strain pattern once they're outside of the womb.
That's correct.
Yeah.
Yeah. And it's almost like if a police officer comes to an accident scene, he's not trying to employ guilt on anyone. He just needs to gather, or she needs to gather the evidence on the mechanism and the details of the accident so
Yeah.
they can document it and see how this might impact their
Yep.
body in the future.
Yeah.
So same thing, we're not trying to shame or blame anyone. It's no one's fault. It is what it is. Everyone did their best, but we just need to do what's best for the baby and politely and gently to gather the information. And that way, when we give a care plan or explain why we're going to care for the infant, now the parent can understand in a concrete manner. And then you can take that same information and share with their pediatrician.
Yep.
And their pediatrician go, oh, that's why the baby might need chiropractic care.
Yeah. That's
Got
great.
it. So it's multifactorial and why it's important to delve into that.
Yeah. And have you developed some good relationships in your community with pediatricians who are becoming more aware that this is an important thing to pay attention to?
I've done my best.
All right. Yeah, fair enough.
Done my best. This depends on the
Yeah.
human.
Yeah.
And I have learned, speaking with other doctors on the country, different areas of the country receive these things differently. So
Yeah.
I can only speak on my behalf, but yeah, there are some forward-thinking pediatricians that understand this and respect it and do things about it, and others are like, don't want to have the conversation at all.
Yeah. Yeah. Fair enough. That's what we've observed in our area as well.
Sure.
Definitely a spectrum. And I think just as a little aside, I want to differentiate when we're speaking about birth trauma, this can obviously birth trauma affects the birthing mother as well. And can affect the baby in emotional ways as well that can be significant. We're speaking more about birth trauma in more of a mechanical sense,
Mhm.
neurobiomechanical sense here. We will definitely have a podcast about birth trauma for moms and how that can affect moms. That's obviously very, very important.
Mhm.
And I would also direct people to Dr. Jay Warren's podcast we did about the emotions around birth imprinting, and how that may show up in the emotional and physical body in very, very real ways. But just as a differentiation, so our listeners understand, we're talking more about the mechanical forces associated with this in this recording. So yeah.
That's right.
Um, Now, we'd mentioned different mechanisms of delivery, methods of delivery, and how that may show up for the infant. You'd mentioned some things that parents may look out for. Are there ways that you wanted to get a little more detailed in terms of what a parent may observe in their infant that may have experienced birth trauma or certain signs or symptoms? I know to elongate on that question, I have found that parents in general are usually very tuned into their infants, especially the moms, and usually will observe something, even if it's not acknowledged by other providers. I will find that when I point things out, it's usually very validating because mom will say, I knew it. Like I knew that I knew that's what was going on with my
Mhm.
infant. And like for them, it seems like it's very validating to be able to point out the nuances of this experience in the infant. And I'm wondering if you've observed that as well.
Yes, I
Yes.
am actually very happy you mentioned that. I didn't think about that, which is probably why you're an excellent podcast interviewer.
Yeah.
I for example, oftentimes I'll hear from the mother, my child just seems to be uncomfortable in their body. Like
Yep.
they're spitting up, they're having this sign or symptom, and the pediatrician might just not really sure what to say. They'll say, "Oh, it's just normal. Their babies are colicky. They're adjusting to the world. They'll grow out of it. They'll get better."
Right.
And that may not be true. We all know the body adapts beautifully. It might adapt in a less than advantageous way, though.
Yeah.
So if a baby's like, mom's like, this baby is always looking right. It won't look left. If I try to turn their head, they scream. Or if they're trying to breastfeed, one side's easy, the other side is more challenging. They kind of burrow into one side and pull back as if they're in pain. These are other, like, I would say, physical signs that this
Yeah.
child's spine might be feeling discomfort.
Yep. Yeah, that the feeding dysfunction is a big one. We have the whole previous podcast we talked a lot about that.
Mhm.
That's obviously a big one to get cued into.
I would think even tummy time. If a baby's a
Yep.
couple months old and just can't stand tummy time and they try to lift their head and whenever they do, they're screaming, their head's kind of cocked one way and it just floats there in one way.
Yep.
That is a sign. This baby's head, if you're looking down your child's spine while they're on their tummy, like from like behind
Yep.
their head should kind of bob back and forth in this figure eight pattern.
Yep.
It should. And if it doesn't, and it's always in one, what we call incorrect motion pattern, repeating repetitively, repetitively, that could be an indicator that their spine isn't functioning like it should.
Yeah, that figure eight pattern is, I'm glad you brought that up as well. That's a neat thing.
Mhm.
We see that in other joints as well. The pelvis tends to move in a figure eight type of pattern and the head as
Isn't
well,
it's
which
amazing.
is pretty amazing. Yeah, yeah, and there's
Yeah.
that bobbing as well as they're
Mhm.
getting more muscle tone. So yeah,
Right.
that's a great point to bring that up when parents notice rigidity towards one way. And usually they'll hold the, especially if parents have had more than one child, they can,
Mhm.
usually compare one to the next. But if it's their
Sure.
first one, they even usually know like, oh, the baby just seems tight all the time, or
Yep.
they
They always
can't
seem
bring their
tight.
legs into extension. Their legs are, or
Yeah.
their legs are always in extension and they can't bring them
Right.
into their belly, right? So
Or their shoulders are touching their ears and they never see the baby's neck. Or it's
that's
hard to
right.
clean under the baby's neck and they
Yep.
can't stand it.
Yep.
Another one I've recently seen is the baby's head shape.
There you go. Yes.
Oftentimes they say, my pediatrician says this is normal, it'll fix itself, which is not true
Yeah.
because if it fixes itself, we wouldn't have helmets out there.
Yeah.
It wouldn't be a thing. So we have to figure out, why is the head shape flat on one side? And what I have found is, if we pull the string and that baby's always looking right and they're being put on their back to sleep, as a pediatrician's, the AMA standard is the back to sleep to avoid SIDS. Whether that may not be true or not, I don't know, but I just know that's their workflow. That if the baby's looking right all the time, their head's going to grow into that flat surface overnight, over a few
Yes.
nights, and they have a head shape issue. So it's not the head shape that's the problem. You're just seeing the tip of the iceberg. The problem or the issue is deeper in the
Yeah,
spine.
that's just it. We always
It's
want good.
another, probably the biggest things right there is what I would say.
Yeah, 100% good spinal tone, right? So we want to be able to sit, and as the infant can enjoy time either on their tummy or in an upright like position and move their head in multiple directions, then it will potentially correct itself over time. But
Right.
and I think you brought up a good point of, oh well, it'll fix itself. And yeah, at what cost though, right? And so like, I think there's this fine line of, are we finding something that isn't there? And like, no, it is very much there, but it can be so nuanced. You mentioned earlier 3% of births are more like a gross trauma. I
Mhm.
don't know if you had mentioned, do you know an incidence for more like those micro traumas, or how often in the literature it seems like those might show up? Because
So
we see a
there's,
lot of those in our practice. Granted, we're seeing a lot of those kiddos that have different things going on, but in our practice, the majority of kiddos have something going on that we see.
I'm working on a study for this. There is nothing out there.
Okay.
And if you are wanting me to speculate, on the record here, I comfortably could say at least 50%
Yep.
of labor and deliveries would have some mild to moderate labor delivery indicator that would suggest subtle, mild, or moderate strain sprain injury to the neck of the
Yep.
child or
Yep.
spine. That's conservative. It could be more. I know some people have said more in various professions, but if I'm just trying to be conservative here,
Yeah,
I wouldn't be surprised.
there's a couple of studies by the osteopaths.
Okay.
They weren't, you're familiar with those ones, right? There's the Fryman one and is it the
Fryman.
Gutman one?
Mhm. Yep.
Uh,
I know they're dated, but I
yeah, I
know
mean,
labor delivery practices haven't changed that much. So I could
it,
assume,
if anything, there's more intervention instead of less if it is
right,
dated. So one could
right.
speculate that incidence may have increased, but even in those
Mhm.
studies, I think they were up at 80 to 90% at times. So that's,
I will tell you this. I tried to do a study in a local hospital here in St. Louis. The hospital is called Mercy Hospital.
Mhm.
And I wanted to do a neonatal spinal assessment screening observation study.
Yes.
No treat, no care, just observation study.
And you would be the
And
main clinician checking all the infants, right? So it'd be, yeah.
correct. I'd
Yep.
be looking all like my goal was to do 1,000 blinded
Yep.
screenings
Yep.
and then look at their labor delivery history and see what the data says.
Interesting.
It took 6 months. It went to the physician council review. It was almost there. I was just trying to reproduce a previous study in the Clinical Journal of Neurosurgery.
Yeah.
And unfortunately, it was declined because no one in the hospital wanted to be the principal lead investigator.
Yeah.
And they said, well, I got an email from their attorney saying that the strategy of the study was not in alignment with the goals and missions of the hospital.
That sounds about right. I mean,
It just is what it is. I'm
yeah.
not trying to oust anyone. I'm just sharing the
Well,
information.
that's tricky, right? Because
Go.
then the hospital might feel responsible. Oh my gosh, she's finding all this trauma. Maybe we don't really like, on the one hand, they probably know, but they just don't
Yeah.
necessarily, they're like, we don't want this public information,
Could,
yeah.
I hate to speculate, but I can understand that that
Yeah.
might increase their liability.
Yeah, that's exactly it. Especially if trauma goes from 3% in terms of a trauma that would be acknowledged that there may be culpability for something like that, to then you're coming up with something that's showing 50, 60, 70, 80%. Like
80%.
that's
That's a
gonna
striking, it's a
that's
striking
gonna
number.
freak people out. Yeah,
It
exactly.
really is. They will have a
Yeah.
sharp decrease in labor delivery at their hospital, which would be a huge financial implication.
Yeah,
Huge.
yeah, yeah, yeah.
Millions.
Yeah, precisely.
So
Yeah.
that's what it is.
Yep. Okay. Well, I mean, hopefully in the next few years we'll see more studies like that be able to get reproduced. And if
Yeah,
not the hospital taking on, at least independent clinicians taking it on in some way.
I'm working with Dr. Joel Alcantara, who's a PhD in the department for the ICPA, to do a clinical study here in my office. It's pending IRB review right now and
Yep.
approval, but once we have it, we can start to do in-clinic observations and reporting of data and have multiple clinics
Yeah.
nationwide pull the same data, and then we can have a huge population study to begin this on our own.
That's great. And a question I would have is the osteopathic studies, which are, I think there's one of them may have 1,000 or 1,500 births. There's a decent number in there.
Mhm.
They were checking the infants, I believe, within the first few days of the birth process. Would you see value? Because sometimes this is something I'm wondered, and I'm not sure if you can speak on that in terms of some of these correcting themselves with just time. That would be the ultimate question of, okay, if you give this a day, you might find one thing. If you give it 2, 3, 4 days, at what point is it time to take action versus allowing the body the opportunity to work through that on its own? Do you see what I'm saying? Like, it making
Yep,
sense? Like,
I sure do.
that's as a
I Go
if I
ahead.
can, sorry, continue with that. One of
Sure.
my deep concerns as a clinician is we never want to rob the body's ability to work through something and learn from something. We just want to assist it when it's stuck, basically, give it a little helping hand when it's stuck. And so I think the line that I find myself on, I'm sure many chiropractors do, is wanting to make sure we're doing just enough to help that infant through, but not so much that we're robbing that infant of the ability to learn strategies on its own in terms of like coping with the world, basically.
Yeah, I would have to agree that early intervention should not be misconstrued as over intervention.
Yes.
We don't want to create a need and a crutch for the body. We just, like you said, gently nudge it. So for me personally, I like day 15. For some reason, day 15 gives that body enough time
Yeah.
to wiggle itself out. If you, and for lack of better terms, let the
Yeah.
baby just kind of do its thing. And then at that point, we can do our newborn spinal screening and go,
Yep.
okay, what happened to labor delivery? What are you seeing now? Here's what I'm finding. Here's what apparently is
Yeah.
stuck. I'm going to go give it a little nudge, and you're going to follow up in a few days and we'll go from there. But we don't want to go overboard or underboard. This is delicate balance of not doing too much
Yeah.
and not doing enough.
It's interesting you said that. Intuitively, and I'm not sure why, but I've always felt that it almost takes the newborns 2 weeks to kind of settle into the world. That's what I've observed as well. And so for
Yep.
me, a lot of the patterns that might show up as a sprain strain sometimes aren't even that apparent right at the start, is what I found. Within, like, it takes sometimes 2 weeks for things to show up.
Yep.
And because everything's so, it's almost like, and this would be for what I would consider a normal full-term infant. If the baby was premature, that would be a little bit different.
Mhm.
Or if the baby had baked a little bit longer, sometimes it just a normal full-term uh infant. That's what I found, is it seems like it takes that amount of time for them to, I guess, for lack of a better term, just like settle into their body or settle into the world, in
I
terms of
kind
like being there.
I do kind of, I'm glad you mentioned that. I do have noticed that if you do like a newborn screening or an assessment on a 3-day old, you might find something small. But if you
Yep.
wait for them to go through maybe a couple growth spurts, you'll notice that it's still that way and they just kind of grow into that restriction.
Yeah, that's
And then
exactly it.
then it becomes more obvious. So even the data I've shown is head shape issues start to arise around 4 to 6 weeks
Yeah.
because the child's brain goes through that first burst of growth at 4 to 6 weeks.
Yep.
And then all of a sudden you go, oh, out of nowhere, my baby's got a flat head. What happened?
Yeah,
Well, they had a
interesting.
precipitating issue
Yep.
that didn't rear its head, for lack of better words,
Yep.
until that brain grew. So I think monitoring this child through their growth spurts is one strategy.
Yeah, and
to identify things.
we've certainly checked infants earlier, and I also encourage that as well. I mean, there's, we just might do nothing at all or very little at that point. But sometimes there is obvious brain strain patterns even at an earlier age as well, and that's usually dependent upon the birth process. If the birth might have been especially intense or traumatic, we've had little
Mhm.
ones stop by on the way back from the hospital. But I do find that 2 weekish mark to be like that magic window of when things
Sure.
start to settle into the body in an interesting way.
I will say, recently had a patient where the mother had pushed for 3 hours because the child's hand was in the way of its
Yep.
head. It's called a hand presentation. And I saw that baby come out. Right after delivery, they had this um, cranial presentation called caput succedaneum, where it's like the back of the head is really, really elongated.
Yes.
That is a indicator right away that there could be some issues. So immediately on, I think day 3, I saw an unlevel jaw. I felt like lumpy and bumpy tissue on the left side of the neck. And I said, okay, we had to take this differently than
Yeah.
a 20-minute pushing phase of a
Sure.
vaginal delivery in a tub, for example. So knowing these details and feeling them sooner than later gives you a head start
Yes.
before you like wait for a problem.
Oh yeah, that's exactly it. Yeah, yeah. That's a great, no, it's a great distinction. Absolutely.
Mhm.
Um, Now I understand with this as well, you've started a foundation recently.
Mhm.
I'd love if we could speak on that a bit and let our listeners know, because this is something that's near and dear to your heart, and it's obviously something we want there to be more
Sure.
awareness of, more ways to mitigate and help out. So
Yeah, so it's in its early inception. I just recently, I think a couple months ago, got 501(c)(3) approval for the United States, and it's called the Birth Trauma Foundation, and it's meant to support families, not just babies or just mothers, but mothers, babies, infants, and fathers. And there's one other foundation in the world like it that I tried to get inspiration from, and they're over in the UK, I think in New Zealand. They're called the Birth Trauma Association. So there's nothing in the US about this. So I thought that we could join forces and bring this to the US, and it's called the Birth Trauma Foundation. And the goal is to, in 3 phases, phase 1, create awareness. So raise funds to pay for media exposure, trying to create public awareness, public service announcements. Phase 2 is raising funds to pay for care for families that can't afford care, whether that be infant care for chiropractors, physical therapy, whether that be pelvic floor physical therapy for the mother.
yeah,
That might be emotional therapy for mothers who have postpartum depression or PTSD from a very tragic labor delivery experience. And then the third phase is to raise funds to donate for uh, research for best practices around birthing. So that's a long journey, but that's the goal of the foundation.
yeah,
And this will probably take 15 to 20 years, unfortunately, but that's what has to be done, I think. And
yeah.
I'm just trying to get it going. That's
Awesome.
it.
Wonderful. No, I mean, it's so important, and we'll make sure to put a link to it in the show notes as well. So for people that are wanting to get more information, I know you
I will say
go
the
ahead.
website's not quite done. It's like it's
Okay.
early interception. So this week I should have it live pretty soon. I have somebody graciously donating their time to make this website,
All
and
right.
I'm
Very
just doing
good.
my best to get everyone together here. So give me a
Yeah.
little bit of time, but it should be hopefully live,
Okay.
in the
Good.
coming months.
Yeah. And what we hadn't mentioned that specifically. We'd obviously mentioned pediatric chiropractors. What other practitioners do you think would be integral as a part of a team for folks that are looking to make sure their infants can thrive and be the best that they can be?
That's a wonderful question. I want this to be all inclusive, not just chiropractic. So
Yeah.
I would think, massage therapists for babies and moms, uh, physical therapists in
Yeah.
some instances, of course, chiropractors. For the mother, it would be maybe a pelvic floor physical therapist.
Yep.
Maybe it would be an emotional counselor who, for people who specialize in birth trauma, I have a couple therapists in St. Louis that I refer to for mothers who have PTSD from what we would call a tragic experience that
Yes.
the mother went through, and even support for the father, because I've seen fathers traumatized by watching their mother and their baby go through this.
Yeah,
I
especially if they're feeling helpless in that situation to do anything. That's
The
it.
father wants to be the protector of the cave, and
Right.
sometimes they don't have the resources or a sense of coherence on how to employ their resources. Most people just don't know what to do, and they're not being told what to do. This foundation will help improve their sense of coherence on how to help themselves in this world.
That's wonderful. Absolutely. Well, is there anything else you wanted to leave our listeners with? I know we could chat for hours about this. I know that you've got patients that are going to be waiting for you pretty soon, little ones that are wanting to get checked. But is there anything else you want to leave our listeners with?
I can't think of anything. I think we did a beautiful job. I think anything more might be too much.
Okay.
I would say I always live on this. If you're a mother or a father listening, or even a chiropractor, always trust your instinct. You
Yeah.
can never go wrong with following your instinct. You always can go wrong if you don't follow it.
Love it.
Love
Beautiful.
it. Just trust your instinct on
Trust
this.
your instinct. Yeah. All right. Thanks so much, Dr. Dorough. Appreciate you joining us for
Uh,
this recording.
I appreciate you having me. Thanks so much, Doc.
Of course.